Hey, it's Bonefist, Peterborough's first real superhero, and in this video, I'll be talking about Naloxone, what it's for, where to get it, how to use it, and how to identify someone who is having an opioid overdose. Naloxone is a medicine every patrolling RLSH and average citizen should try and acquire. It is used to null the effects of an opioid on a person who is overdosing so that they will live long enough for the paramedics to get there and to give them proper medical attention. It's especially useful in areas that have high drug usage or high amounts of overdoses. Acquiring naloxone is very simple. Most pharmacies will carry a free kit that you can come and get, and they will also give you a free lesson on how to use it and how to look for signs of an overdose. These kits could come in two forms, a nasal spray or an injection. Mine was a nasal spray. It came with this case, 2 sprays, gloves, and then a little pamphlet that kind of explains the signs to look for and the steps to follow when encountering someone on an overdose. If you think you've encountered a person who may be experiencing an opioid overdose, some of the signs to look for are if they can't be woken up, if their breathing has slowed or stopped completely, if their nails or their lips are turning blue or purple, if their eyes are, their pupils are getting very small or their eyes are rolling into the back of their head, if their limbs or their body is very limp, then those are some of the signs, and you should administer the naloxone and go through the steps that I will be going through. Now, how should you respond once you've come across this person on an opioid overdose? Firstly, you want to shout and shake. Now, you want to shout their name and, of course, shake them. If you don't know their name, shout whatever you can, wake up, try and get their name, try and ask questions, try and get them to be responsive. Secondly, you want to call 911. Of course, explain the situation as best as you can. And then third, you're going to want to administer the naloxone. So if it's the nasal spray, you're going to take it. I'm not sure if you can see, but you put 2 fingers on the top, and then the bottom, your thumb, is what you push on like the little button, and that'll inject or spray the nasal spray up into their nose, and it'll work almost immediately. After that, you want to use CPR if need be, if they're not breathing or if their breathing is very slow, and then use CPR and try and get them back to breathing. And then the final step, if nothing is working and no improvements, you want to give them more naloxone and repeat the steps again. Give them more CPR, more naloxone if you can, and hopefully by then the paramedics will be there. Now, if the person begins to breathe on their own, you want to put them in the recovery position until paramedics can get there. Now, what that is you will lay them on their side, and the leg that isn't on the ground, you're going to put that knee out so it's supporting them, so they're keeping up on their side. And you want to use their arm that is up to put it under their head to support their head and kind of keep their head up a bit so that their airway is open. That'll prevent them from possibly choking on their vomit. That's the main use of the recovery position. My final tip for using the naloxone is that if you're going to use it, make sure the person, when they awake, or when they awake from the CPR that you may be giving them, or from whatever the situation may be, they may be violent from the shock, or possibly from the lack of taking their high away from their drugs. The different situations may cause them to be violent or aggressive towards you, so be wary with those situations. Now, if you can, I want you to pick up naloxone and learn as much as you can about it and overdosing, so you can possibly save a life if need be, if it came to that situation. Make sure to like, share, and subscribe, and if there's anything you think I missed, leave it in the comments below, and stay safe out there. Thanks for watching. Bonefist out.